Hello, thank you for listening to our presentation, Assembling a Framework of Core Competencies in Global Health to Optimize Interprofessional Practice Experiences. We hope that you enjoy our presentation about our own framework for our interprofessional global health experience in Botswana, Africa.
Interprofessional education, often abbreviated IPE, occurs when professionals from different backgrounds provide insight regarding what their line of work entails. Interprofessional practice, abbreviated IPP, requires professionals to contribute their knowledge to develop a solution to a greater problem at hand. IPE lays the foundation of IPP, and before a team can work cohesively, they must first understand what each member contributes. We formed an interprofessional team of graduate speech-language pathology, audiology, and physical therapy students along with 2 supervisors and traveled to Botswana, Africa. Our interdisciplinary team collaborated with an international team to discuss the differences and similarities between our methods of patient care. Together, we were able to facilitate an international IPP based off of findings in existing literature. Our main objective was to use our real-world experiences from our time in Botswana, Africa to develop tips for optimal success when collaborating with other cultures or professional groups.
The following are steps that can be taken to create a framework of core competencies for interprofessional global health programs. Develop an interprofessional team, including speech-language pathologists, audiologists, and physical therapists. Other professions can be added. This list was specific to our experience. Develop connections with allied healthcare professionals abroad. Connect with professionals in your respective field for the best collaboration. Learn about the medical and educational culture of Botswana through various documentaries, texts, and informational sessions. Be mindful of cultural differences. Collect literature documenting successful international health program ventures in order to choose key elements of these programs to implement as a team.
Collectively, we developed a list of 10 main competencies as to what we decided are the most important guidelines for successful interprofessional and international programs based off of our own experiences in Botswana, as well as suggestions from published articles. 1. Be aware of relevant social sciences, and humanities of the group in which you are interacting. 2. Read literature to immerse yourself within a new culture in order to gain a different perspective. 3. Find elements of cultural and human diversity that you can connect with and appreciate. 4. Learn to engage with professionals and practice open communication. In other words, put yourself in your team member's shoes. 5. Develop a rich understanding of systems of care in both domestic and international settings to promote meaningful discussion. 6. Effectively enhance leadership and teamwork skills. 7. Communicate ideas about health and well-being of individuals we interact with to other professionals, community leaders, and the general public. 8. Optimize the scope of practice for speech-language pathologists, audiologists, and physical therapists by working as a team. 9. Articulate shared goals, ethics, and values within your team. And 10. Develop international partnerships and sustain those relationships.
Now we are going to discuss how these main competencies fit into our own experience abroad. Prior to our trip, we reviewed literature to immerse ourselves within the new culture we were about to experience. We further reviewed articles and existing research to help us develop a foundational framework for our interdisciplinary work both between disciplines and globally. During our trip, we were able to practice leadership and effective teamwork by composing a presentation for the annual tea party for Ambrose Trust and Mariri Clinic. We worked as an interdisciplinary team to compose a presentation on sensory integration disorders. As a team, we went through each of the disorders and were able to break them down in a manner that the caregivers and educators would understand. as well as providing suggestions and environmental modifications to assist children that exhibit these behaviors. During this presentation, we were further able to communicate ideas about the health and well-being of these children to professionals, community leaders, and caregivers who attended this event.
So this trip provided us with many opportunities to optimize our scope of practices as speech pathologists, audiologists, and physical therapists working together. And some of these things focus on optimal clinical placements. So in Botswana, we were able to go to places in which all of our professions were working together, which was a really great thing to see because oftentimes in the US, we're split in our own areas and we don't have much interaction besides via paperwork. So it was really, really interesting to learn from and with each other and to see these patients together. We also had discussions focused on shared goals, so we really got to get a better understanding and awareness of what we do as professionals, which is really important because it helps with knowing when to refer, knowing when to collaborate with another professional. So this was really, really helpful in itself. And in residing in Botswana for the 2 weeks, we were able to completely immerse ourselves in the culture, which in itself was just an amazing experience. We not only got to learn the healthcare system and how it worked, but also, what these individuals were doing for fun, what they do in their leisure time, how they go about their day, their schedules. We learned that it's very different. It's more relaxed, which was very nice. So we got to really immerse ourselves that way. Also, we learned how to advocate better for healthcare. In the US, we advocate for our professions in itself, but we learned how important it is to work on a global level and make sure that we are pushing for these services in areas that may not have them. One SLP would cover an entire school setting and medical setting. There's just not enough hands for all the people that need our services. And that's just one example, same with audiology and physical therapists. So we really learned how important it is to get the word out there and to really advocate for our services, to collaborate with teachers, to collaborate with the people that are working with the students and the adults that we are working with, and really make sure that they're getting the services that we need. And finally, the Ohio University Botswana Rehabilitation Services trip has developed a lifelong partnership for the global healthcare community, and in doing so, we create materials for the people that live in Botswana, and they collaborate with us. They let us know what we need, what they need, and it has just become a really, really great relationship.
Thank you for taking the time to watch our presentation on our real-world experiences we use to develop tips for optimal success when collaborating with other cultures or professional groups. We hope you enjoyed our presentation.